Kia ora koutou katoa, welcome to the Ministry of Health today. Relatively short briefing this morning because you'll be aware the PM is doing another briefing not too far in the future, and so I'll get through a summary of the cases and some other relevant developments. So there are 14 new cases of COVID-19 confirmed in the past 24 hours in New Zealand. The locations of these new cases are 4 in Wellington, 1 in Taranaki, 3 in Auckland, 1 in Waikato, 1 in Taupo, 1 in Manawatu, and 2 in Nelson. This brings the total number of COVID-19 cases in New Zealand to 53 confirmed, and we have 4 probable cases. Most of these cases are travel-related, but as yet, in 2 instances, no link to overseas travel has been ascertained, and we continue to investigate. So, at this point, we cannot rule out a risk of community transmission in these cases. So, detail for each of the 14 cases will be on the Ministry of Health website as it is finalised. The website will continue to be updated as fuller information is received. We always knew that cases apparently not linked to travel would happen, and we are prepared for that. And it is now more important than ever that we continue our efforts to track and trace individuals who may have been in contact with confirmed COVID-19 cases and get those people into self-isolation so that we can contain any further spread. Physical distancing is, of course, fundamental to our collective response, and we ask all New Zealanders to conscientiously play their part in following the guidelines related to social contact and the ban on mass gatherings larger than 100 people indoors or 500 people outdoors. Both are on, those guidelines are on the Ministry of Health's website. So the number of new cases is in line with what we've seen in the last few days, and around 1,500 tests were processed yesterday and overnight. 3 of the confirmed cases are in hospital. A man in his 60s is in Lakes District Hospital in Queenstown. That's the same as yesterday, and his condition is stable. A woman is also in hospital in Nelson, and she is stable. And there is a further person in a stable condition in North Shore Hospital. On to cruise ships. So, as you would have seen through a media release yesterday, an Australian cruise ship, the Ruby Princess, which left New Zealand 5 days ago, has had 3 Australian passengers and 1 crew member test positive for COVID-19. So swabs that were taken on board the ship were tested once the ship berthed. It arrived in Sydney on the 19th of March, and the results from those swabs were that there were 3 passengers and 1 crew member testing positive. So we are in the process of contacting the 56 New Zealanders who were on board that ship, and that includes 28 who have already returned to New Zealand. A reminder that those who have returned to New Zealand already, and of course those coming back still, will have been captured by the requirement since the 15th of March that all travellers returning to New Zealand go into self-isolation for 14 days. We are now considering all those people on that ship as close contacts, so in addition to being in self-isolation, they will be monitored daily by health officials. So details of the movement of that ship and a further ship, the Celebrity Solstice, which had a confirmed COVID-19 case of a New Zealander on board, can be found on the Ministry of Health's website, and our media release will have that link. Finally, just in terms of this weekend and providing support and ensuring that people are well, especially those in self-isolation, a reminder that self-isolation does not mean social isolation. Physical distancing does not mean social distancing. It's really important for mental well-being that we stay connected with each other more so than ever. There are many ways to reach out to people through phone, social media, online contact, even if you can't visit them in person. Talking to people and checking in on others keeps us all connected, and as I say, this is more important than ever. The smallest and largest question you can ask someone is, are you okay? That's the end of my comments, and I'm open to questions.
Where were the two cases that weren't linked to travel?
So one of those is in the Auckland region and one is in the Greater Wellington region.
But you can't categorically say that that is community transmission.
We haven't been able to, as yet, ascertain an overseas travel link, and so we're continuing to investigate. So that means we can't rule out the risk that there was community transmission.
Can you be more specific about where in Auckland, where in Greater Wellington?
I don't have the detail about the Auckland case. In terms of the other one, that's in the Wairarapa.
When you say we can ascertain a link between them and overseas travel, can you say whether they travelled overseas, these individuals in particular?
Yes, I can say that. Neither of them had travelled overseas, and so then what we are looking at is whether anyone they have had close contact with has travelled overseas. In one case, that is the Auckland case, the partner of the person has a lot of contact with overseas travellers in the course of their work, and the partner is being tested. We don't have that result yet. In the case of the other one, there's no obvious link at this point as we go back and investigate to either overseas travel on the part of the person or to someone who has recently travelled overseas.
If that person's partner got it from someone who had travelled overseas, would that be community transmission? Did someone giving it to someone else who they're not intimately related with?
Sure. What it would show us is that there was an obvious link to someone who had come in from overseas, and given that there is quite wide transmission now in a range of countries, that would provide us with a clue to where the source of the infection was, and the fact that, as we've seen with many cases, there is transmission most commonly inside the home. So there would be a feasible explanation. In the case of the Auckland case, in the Wairarapa one, it's not clear, so we can't rule out the risk of community transmission.
In regards to the trade line staying open with Singapore, how crucial is that? What sort of medical supplies would we be getting from Singapore?
Well, we're certainly, the trade lines are open with every country, and one of the things we've been very careful is to make sure that it's clear that the ban on visitors coming into New Zealand is not affecting air or sea freight, and so our supply chains are good. Singapore is a really key trade line for us, and in particular we've been successful in getting some additional testing kits from Singapore, which were secured yesterday, which will assist us with ensuring that everybody who needs a test can be tested.
Why weren't we testing at capacity sooner? Would we have not figured out if we had community transmission if we had been testing more sensibly?
So what I can say is that testing has ramped up as the practitioners have identified people who need testing, and so right from early on we were testing the people who we felt needed testing based on overseas travel link. As more people have come into the country who have been overseas, then more testing has happened. What I can also say is that in the last 2 days we've done yesterday the 1,500 tests, and the day before 1,000 tests. So there is a large number of tests being done that will help us have an early signal as to whether there is community transmission in one or more locations. So I think the volume of testing now is good. And just for comparison, South Korea's testing capacity was about 10,000 tests per day, with a population about 10 times the size of ours. So I think our testing capacity is good, and what we want to do is make sure that we are doing the number of tests that need to be done.
Just for that Wairarapa case, if there's no obvious link to someone who has been travelling, doesn't that mean then categorically it is community transmission?
Well, we can't rule out that there was community transmission, but what we're also interested to understand is whether that community transmission happened there or somewhere else in the country, and also, of course, understand whether there's a risk of any further community transmission in the Wairarapa.
Can you say where in the Wairarapa?
Well, I'm not going to say exactly where the person lives because of privacy. It's a small place, but it's in the Wairarapa.
Is that person showing any symptoms?
He was symptomatic, and that's why he was tested. And the clinician felt that there was, again, because clinicians can use judgment, even if there is no risk of overseas travel, the clinician decided to do a swab for COVID-19, and that came back positive. So it's good we're finding these cases.
Can you tell us whether the 56 people on the Ruby Princess are all being tested when they're being contacted?
They are not, if they are not symptomatic. If they develop symptoms, given, and that's what the purpose of the daily check-in is, then they will be tested.
Should they not be tested? Should they be tested?
They'll be tested if they develop symptoms. The key thing is to have them in self-isolation. If they're not symptomatic, they don't need to be tested, but they will be if they develop
And
symptoms.
in regards to universities, is it safe to go to lectures at the moment?
One thing I'm aware is that many universities have already started doing lectures remotely in an effort to help create physical distance between students. That's fantastic. And I think in either a university setting, a school setting, any setting, if people are putting in place processes that help reduce close contact for long periods between students, that's what we're aiming for.
What about
The
those?
email address that was set up for complaints for people who weren't self-isolating, it's now been flooded with emails. Are you concerned that people aren't taking this seriously?
Look, I think people will be taking it very seriously. They will understand the expectation. Sometimes the complaints or the reports are because there's not an understanding of what the expectation is around self-isolation. So again, just to reaffirm, if people have travelled from overseas but haven't had contact with a case, so they're not a close contact or a case themselves, people are still allowed to go out and do things. It's just to avoid that social contact. Those who are cases or close contacts, the expectation is that they will be in their own home.
On that note, tourists that are coming in that have to self-isolate for 2 weeks, are they allowed to go out and get necessities?
They need to make arrangements to ensure that they are not having contact with other people, and there are lots of ways to do that, and our advice on self-isolation has got really good recommendations around how to do that.
Are there any measures in place to protect smaller islands off the coast of New Zealand, such as Great Barrier Island, for those communities that have limited health resources and are already quite isolated? Are there any measures going to be put in place to stop tourists going to those places?
Not specifically at this point, but that's something that, of course, is part of the planning.
And just
Interesting.
with,
We've heard about large crowds at Auckland Airport, people trying to get out. Are you concerned about that? Do you have any messages there?
People trying to leave the country, you mean? Yes. Well, of course, airports do tend to be crowded places. I do know that there's a lot of work at the airport to help reduce risk to anyone there, including staff and, of course, people travelling or visitors. So I'm assuming that the airport authorities will be looking at ways to help reduce any possibility of risk to both passengers, visitors and also to staff.
Okay, we're short today, so a couple more questions.
Some of those 56 have been in New Zealand before on the cruise ship and then
Yeah.
going to Australia. Are you tracing their movement, or you only observe that test positive after showing symptoms?
Yes, so two things there. One is, of course, is if those people are close contacts, we will be asking them about what they did since when they were on the cruise ship and subsequently. But also we are looking at the movements of the two cruise ships around New Zealand, just to see whether there were any risk to others when those cruise ships were in port. We haven't found anything at the moment. And I should say that in the case of the Ruby Princess, when the ship docked in Wellington, there were people on board who had influenza-like illnesses. Now, anyone with any sort of illness is not allowed to actually get off the ship at a port and do the visit until they are well. And the ships also have point-of-care testing, so they can test to confirm influenza. When the ship docked in Wellington, actually, there were 5 people who were tested for COVID-19, and those tests were all negative. So the fact that there has subsequently been COVID-19 positive tests on there is interesting, but they were obviously not the people who were tested when that ship was in Wellington.
Have you ever considered to quarantine that ship because people on there showed flu-like symptoms?
So that the ship has now finished its cruise and is back in Sydney.
Sure, but if it showed up in Wellington and people with flu-like symptoms, the ship is obliged to tell health authorities that, is it not? And we have the power under the Health Act to quarantine that ship.
Yes, there is that power. And so what the ships were doing at the time was identifying any people with influenza-like illness. Of course, they have very stringent processes they put in place. They isolate these passengers or crew, if they're crew, and they're not allowed to have contact with other passengers. And in this case, of course, when it came into Wellington, because there was an extra level of precaution being applied, the people who had influenza symptoms on board were tested for COVID-19, and those tests were negative too.
Are you going to continue testing at capacity?
We'll continue to do the testing of the people who need to be tested, and all our labs are continuing to increase the capacity. We want to be able to test those who need testing. We don't want to spend our lab capacity testing people who don't need to be tested. So it's very important that people are honest about travel history. This is not just a free-for-all to go and get a test because you might be anxious. We need to make sure that our laboratory staff and our machines and our supplies are used to identify possible cases of COVID-19, and then we can take the appropriate action. Final question?
If you have someone who has tested positive for COVID-19. They haven't travelled overseas. None of their immediate family members have travelled overseas. Isn't that community transmission, even if it's limited community transmission, even if you're able to figure out where it came from, isn't that
Sure.
community transmission?
It certainly raises the risk of that. The investigation is still ongoing, and in fact, in the case of the Wairarapa person, there is a couple of close contacts who are being tested as well, so we're waiting the results of those tests. So, look, thank you very much. I did say it was going to be a slightly briefer stand-up today. I do appreciate your interest and look forward to seeing you again.
Just confirm if surveillance sentinel testing is going?
No, that doesn't usually start till the end of April, but we are bringing forward our surveillance to the start of April. Actually, can I just make one further comment? Today is the 62nd day since we stood up our National Health Coordination Centre, and many of you have been at the daily briefings here, and I just want to acknowledge the dozens and now hundreds of people who have been working behind the scenes. You don't see them, you just see me here, but there are many, many people who have been working very long hours and very hard for the public over the last 62 days, and I want to acknowledge them and say ngā mihi nui kia koutou. Thank you very much.